Hi guys, so today I am continuing my video on the thyroid gland. I've already covered the first video which is based on the introduction of the thyroid gland. So this was the video. I will recommend you to watch this video before you go ahead to watch the second part of the video on the thyroid gland. So in the second part of the video on the thyroid gland, we'll be taking up the external features of the gland. Now, in the external features of the gland, first of all, you have to see, this is my thyroid gland. Now, in the thyroid gland, I can appreciate two lateral borders, one isthmus, which is connecting the two lateral borders, and the pyramidal lobe, which is present above the isthmus. And this is levator thyroidae, levator glandulae thyroidae. This is going to connect the pyramidal lobe or the apex of the pyramidal lobe to that of the head bone. Okay, anterior to the thyroid cartilage. So I'm going to discuss all of these features in detail. First of all, we have the two lateral lobes in the thyroid gland. So in the lateral lobes, we have some basic external features like we can see the apex, we can see the base, and we can see anterior and posterior borders along with anterolateral, medial and posterolateral surfaces. So let's start. First of all, we'll see the apex. Now you can see this is the apex of the thyroid gland. Now we know about the thyroid cartilage. I have already uploaded a video on the thyroid cartilage also. Thyroid cartilage possesses an oblique line. Now on this oblique line, we have three muscles which are originating and inserting. So they are originating. So first of all, we can have the thyroid. So thyroid, that is the first muscle. So this is the muscle, which is the thyroid muscle. Now this muscle is going to come from the oblique line to the hyoid bone. Second is the sternothyroid. So first is thyrohyoid, second is sternothyroid. It's going to come from the thyroid bone attaching onto the sternum. Then you have the inferior constrictor of the pharynx. So this is the third muscle, the inferior constrictor of the pharynx, which is coming from the oblique line and inserting onto the cricoid cartilage. This one is the cricoid cartilage above the first tracheal ring. Okay. Now the apex of the gland is limited in between the sternothyroid and the inferior constrictor of the pharynx. And we have one important nerve and artery present in relation to the apex of the gland. So the important nerve is the external laryngeal nerve and the artery is the superior thyroid artery. So now here this is the diagrammatic representation for the apex of the thyroid gland. So this is the apex of the thyroid gland. This one, the pink structure which I have drawn. Now this apex, I told you that the growth of the apex is limited by the sternothyroid muscle, which is this muscle, and the inferior constrictor of pharynx, which is this muscle. Now the important nerve and artery present is the external laryngeal nerve and the superior thyroid artery. Both of these structures are going to diverge in relation to the apex of the thyroid gland. So whenever we want to ligate the superior thyroid artery for the removal of the thyroid gland in case of tumors in the thyroid gland, we have to ligate the superior thyroid artery. We ligate the superior thyroid artery in relation to the apex of the thyroid gland because the external laryngeal nerve is present deep and the superior thyroid artery is present superficial. And these structures are divergent also to each other, so will not cause damage to the external laryngeal nerve in this process. Okay, so this is one implied anatomy in relation to the apex of the thyroid gland. Moving ahead to the base. Now this one is the base of the thyroid gland. Now for the base, you have, first of all, you can see that there are 5th or 6th tracheal rings. So it's going to be associated to 5th or the 6th tracheal rings, or for that matter 4th tracheal ring also. And also we remember that since here we had the superior thyroid artery and the external laryngeal nerve, here we'll have the inferior thyroid artery and the recurrent laryngeal nerve. Now both of these structures are going to be convergent to each other. That means in the base, even though they have variable relationships, but they are going to converge to each other. And converging, these two structures, when they're converging, whenever there is any problem, any pituitary, any tumor in the thyroid gland, and we need to ligate the inferior thyroid artery also along with the superior thyroid artery. तो superior thyroid artery हम हमेशा apex के relation में करते हैं thyroid gland के, but the inferior thyroid artery is ligated away from the base because in the base it is convergent to the recurrent laryngeal nerve also. So we have to, whenever we have to ligate the inferior thyroid artery, then we'll do it away from the base of the thyroid gland. So this was the clinical in relation to the base of the thyroid gland. Now moving ahead, second thing we have is the borders and the surfaces. So we have these three surfaces, which is the anterolateral surface, then medial surface, and the posterolateral surface. Now anterolateral surface is this one. This is the anterolateral aspect. So this is the hyoid bone. So this surface is going to be below the hyoid bone. So it's going to be related to the ribbon muscles or the infrahyoid muscles. These are my infrahyoid muscles, and you're going to remember all of these muscles by the simple letter S. Superior sternothyroid, sternohyoid, superior belly of omohyoid, and the anterior belly of sternocleidomastoid. Medially it's related to trachea, esophagus, external internal laryngeal nerves, and the inferior constrictor along with the cricothyroid muscle. And the posterolateral surface is related to the carotid sheath containing the internal carotid artery, vagus nerve, and the internal jugular vein. I'll draw you a diagram for this, so it will be very easy for us to remember all of these relations. Now anterior border and posterior border. Anterior borders represent between the anterior lateral surface and the medial surface, and posterior border is present between the medial surface and the posterior lateral surface. Now as promised, I am going to draw you the diagram, but before that we are going to understand the isthmus. Now I told you that the two lateral lobes are united with the help of isthmus, which is 1.25 centimeters long structure. Now this isthmus which is present, this isthmus can be sometimes absent also, but it is majorly the function of the isthmus is just to unite the two lobes of the thyroid gland together. Second thing is the pyramidal lobe. It is extending from the isthmus, and this pyramidal lobe is present only and only in 33% of the population. So this pyramidal lobe, it is present only in 33% of the individuals, and this pyramidal lobe is extending from the isthmus. So it's extending from the isthmus, and this pyramidal lobe, it is going to, the apex of the pyramidal lobe is going to connect to the hyoid bone with the help of levator glandulae thyroidae. Okay, now remember one more clinical for the pyramidal lobe. I'll write it down. Now if you want to cut the pyramidal lobe, it is present in 33% of individuals, and the individuals, if it's present, the patient comes to you to cut the pyramidal lobe. So you can easily cut it without any damage or without any hemorrhage, only at the apex, because apex has no arterial supply. So considering apex having no arterial supply, we can easily cut the apex of the pyramidal lobe, but the base, it has superior thyroid artery. So base has arterial supply. You cannot cut the base. If you cut the base, you are going to damage the superior thyroid artery, which is going to cause excessive hemorrhage. You can only cut the apex of the pyramidal lobe without any damage. So now we are going to start with the diagrammatic representation. It's advisable for you to draw this diagrammatic representation in exams. Okay, so I'll just draw it, and I will explain you also how we do it. So draw simultaneously. Now this is the thyroid lobe. This is the lobe of the thyroid gland. Okay, now anatomical locations may, I can just make a diagram here to explain you, right? That this has to be the anterolateral surface. The anterolateral surface. Now this is my anterolateral surface as I wanted. This is my medial surface. This is my medial surface here, and here this is the posterolateral surface. Now if you just go back to the video, you will see that the anterolateral surface is related to the hyoid bones, is related to the infrahyoid muscles or the ribbon muscles, which is written here, that the anterolateral surface, it is related to the ribbon muscles or the infrahyoid muscles. Okay, and we have learned the name of these muscles with a simple letter S. Let's write them down. First of all, we have the anterior belly of the sternocleidomastoid. So this is my anterior belly of sternocleidomastoid muscle. Okay, then you can have another. I told you sternothyroid and sternohyoid. So this is my sternohyoid, and here I'll have the sternothyroid. Now here we have the superior belly of the omohyoid. Superior belly of omohyoid. So this is my anterolateral surface, and you can again check it out. Anterolateral surface or the infrahyoid surface containing the sternohyoid, superior belly of omohyoid, and the anterior border of this is not the border, this is not the belly, this is border. Anterior border of sternocleidomastoid. Now we are proceeding for the posterolateral surface, and you will remember posterolateral surface contains the carotid sheath with the vagus nerve and the internal jugular vein and internal carotid artery. Now this is my internal jugular vein. You have to follow the sign conventions in your exams, that the nerve has to be drawn with the yellow color, vein with the blue color, and the artery with the red color. So it's important to follow these conventions here as well. This is the internal carotid artery, and this is my vagus nerve. So this is my vagus nerve. Now this is my medial surface. So the medial surface is going to contain the trachea, esophagus, and the recurrent laryngeal nerve. So I'll draw it. First of all, I'll draw the trachea because it is anteriorly located. Then you have the esophagus. This is my esophagus. And I'm going to draw my nerves. So the important nerves present in this relation are going to be the the external laryngeal and the recurrent laryngeal nerves. So this is my trachea. This is my trachea. This is esophagus. This is external laryngeal and the recurrent laryngeal nerve. So these are the two important structures that are there in the medial aspect of the thyroid gland. Here you will have the parathyroid gland here. And this is going to extend to form the isthmus. So that's it for the video. These are for the external features of the gland. In the coming video, we're going to discuss the blood supply and the applied anatomy of the gland. So thank you so much.